We'll look it up and see how.
Recording in progress.
Okay. So it says if you go to the participants
Mm-hmm.
and you click on the participants and you hover over the name of the person you want to do, so hover over Howard, click, and then there's a thing that comes up and it says click more. So you click the word more and it says click make co-host. Drop down menu.
Multi-pin, rename. Yeah, when I hover over it, nothing pops up. There's kind of a little 3-dot little thing is typically where you can make a co-host, but I'm not sure. I think you've got to edit that something in the settings to put that in there.
Okay.
Yeah. It'll be all right if we need to assign.
When you do the 3 dots, you don't see something that says more?
No.
Or,
No, just it says report, remove, put in waiting room, etc. Rename, make host, but not co-host. So,
okay. All right.
Yep.
Well, let's go ahead and get started with this and
sure.
we'll see if anybody else starts to come in, but I sent it out to quite a few people, so I'm surprised there are only 10 so far, but it's a good start, I guess. You know what, real quick, while we get everybody started, if everybody wants to just come on real quick and tell me who you are and what business you're with, that'll be great. We'll have you introduce yourselves to both Howard and Mitch. So Rich, we'll start with you. Rich, who are you? And
got to unmute first. I'm Richard Frymoyer. Currently, I am the secretary, treasurer, CFO, probably personnel manager, maybe operations manager of a startup in Delaware. Right now, we have absolutely no revenue, sort of no money, and we're hoping all that changes in the next 2 or 3 months. So if that happens, we're going to have employees. We're going to have some of whom are going to need medical insurance. So I'm starting to shop, see what kind of options might be floating around.
All right, perfect. Krista, thank you. Krista's with Impact Graphics and Signs. First said her microphone's not working. Dina is actually in my office. Amelia, so tell us a little about who you are. Amelia, your microphone's not working.
I basically work with Howard on the back office for this service. So I'm on the Howard team today.
Okay. And I know, Chris, you're with Insperity, but go ahead and introduce yourself anyway. You have to unmute yourself there first, Chris. Chris, you're muted. You have to unmute yourself.
We're still muted. There you go.
There you go. To press the button. Sorry. My name is Chris Appellian. I'm with Insperity. I work with small to mid-sized businesses, and what I do is I help them out with HR infrastructure, efficiency, compliance. I do dabble in the benefit space and what we do on a bigger work model, but for the small to mid-sized industry, really wanting to help them out with making sure their payroll is compliant, they're onboarding correctly, offboarding correctly, getting an employee handbook done in a compliant manner. Having a learning management system for their employees and really helping them attract and retain top talent. And in a nutshell, that's what Insperity does.
Perfect. Thank you, Chris. Don?
Good morning, everyone. I'm actually I'm here on behalf of my wife. She's with the Delaware Small Business Association. It's Eleanor's Maid Cleaning Services, and I'm just listening in to see what options. I must admit, America Choice is something we'd like to have more information on as well. So just for food for thought.
Tell Eleanor I said hi, and we're going to teach you how to say Delaware Small Business Chamber, but that's okay. We'll get you there.
Yeah, that's my bad.
No problem. All right, and Alex, you are. Alex, you unmuted yourself, but I can't hear you. Alex, you might want to type in the chat because I'm not hearing you, but you did unmute yourself, so I'm not sure what happened there. And did I miss anybody? I didn't miss anybody, right? All right. And then Mitch, I'll let you and Howard introduce yourself.
Yeah, I can start by introducing myself and we'll move to Howard. My name's Mitchell Fink, so I am the Vice President of Affordicare Insurance. So we are an employee benefits brokerage, 58 offices across the U.S., about 11,000 employees. Super excited to partner with Bob on these great programs.
And my name is Howard Polanski. I work with Mitch, and I'm the one who kind of instigated all this in terms of reaching out to Bob and other chambers of commerce to bring additional benefits to not only the chamber, but their members. But I'm going to let Mitch take it away.
Well, before Mitch does, let me just explain one thing to everybody here, and so we can let people know about this through other members and prospective members. So what Alex Alex Avery Hall, okay. Good. So just to let everybody know, so Howard did reach out on another plan that we're going to talk about a little bit today. It's an employee plan. And in my conversation with Mitch and Howard, I explained how Delaware is pretty much a monopoly in the healthcare world, and how I've been trying for many, many years to get a new plan in place for Delaware. We had one, it didn't work out quite well. So in that realm, both Mitch and Howard went out and brought in a very well-known company that I'm gonna let Mitch talk about, and offered another plan for health insurance for small business, as well as the benefits program that started the conversation. So this is a two-part relationship that I have with these guys, because it started out with a benefits program that's pretty cool, and then went into adding the health insurance for us and a special deal for our members. So with that, Mitch, I'll let you take it out.
Perfect. Yeah, I'm just glad that everybody's on the call. It's great to meet everybody. As Bob mentioned, when I approached Bob and Howard introduced me to Bob, the big task at hand was finding a competitive, well-known health insurance benefits program that was accepted at all of your local facilities. So being that we're an employee benefits brokerage, we have 127 companies that we work with. Okay, so I had my work cut out. We basically did what we call a disruption report. We look at all the best facilities, the most well-known facilities in that area, and we start to narrow it down to carriers that will accept those benefits. Okay, and we found one. We found a very, very well-known carrier. And this carrier, the name of this carrier is United Healthcare. Okay. Now, everybody has typically heard of United Healthcare, but what I will tell you is this particular program and plan that United Healthcare is offering is a very unique program. It is not typically like the traditional insurances that are on the market. So we're excited to say that we've partnered with United Healthcare to be able to offer this program through the Delaware Chamber, the Small Business Chamber, and it's accepted at all the facilities. So very excited to see that all those facilities accepted the benefits there. But what I think you're going to absolutely love about this carrier's group health insurance is how competitive they are on the pricing. Okay. Now, I'm sure a lot of you have probably talked to someone that offers benefits, and they're always going to say, hey, yeah, we're super competitive on our pricing. Well, let me explain to you how this level funded United Healthcare insurance plan is competitive versus the other plans that are out there. So for many, many years, the health insurance plans that were on the market, they're called fully insured plans. Okay. They're not underwritten. Now, when I say fully insured plans, it's like a Blue Cross Blue Shield plan. There's a few other carriers out there, but Blue Cross is the most well-known. And those are fully insured plans, meaning they don't underwrite those plans. So they don't necessarily know the health of your employees. So they give you a rate, really not knowing the health of your employees and how many claims that they will file. The problem with that is the fact that those prices are very high based on assuming you're going to have a lot of claims on these plans. Now, the solution to that, United Healthcare has what they call a level funded plan. A level funded plan is an underwritten plan. What we do when we go and quote out a health insurance plan for your group is we assess the health of your group. Okay. Now we know that not everybody's going to be healthy in a group. Okay. That's okay. That doesn't exclude you. That doesn't mean this isn't a good fit for your business. But what United Healthcare does to make our rates extremely competitive is we go in and we take a look at your employees' health, a brief survey. It's just a few questions that you answer to assess the health of your group. And then we give you a more refined rate according to the health of your group. Now, here's an exciting statistic. Our average right now, we're coming in about 20 to 30% less than the fully insured plans that are on the market. So now you have a solution through the Delaware Small Business Chamber that will give you a very well-known name, United Healthcare, and a better rate on the group health insurance because we assess the health of your employees and give you a rate based on the health of your group versus just giving you a rate based on however many employees you have. So we're very excited to be able to start to give you some options and give you some quotes and give you some numbers on exactly how much we can potentially save you on your health insurance. Now, another really great feature about these United Healthcare level funded plans is they have what they call a return of premium feature. Okay. What that means is if you have minimal amount of claims throughout the year. Now, keep in mind, guys and gals that are on this call, we know you're going to use the insurance, right? But as long as you don't have any catastrophic claims, okay, throughout the year, you can potentially get a percentage of your premiums returned back to you. Okay. So a lot of the groups that I've landed, and I've been doing this for 17 years, a lot of the groups that have these United Healthcare plans, at the end of the year, they get a big check back from us because they had a good year. They didn't overly use their insurance. So they're going to actually get a percentage of their premiums returned back to them that they can do whatever they want with. So not only are you going to have access to a program that is, in my opinion, the absolute most competitive health insurance plan on the market right now, but it also is going to give you a great rate. You're going to be able to use this at all the local facilities, and you could potentially get a return of premium feature at the end of the year, which is really great. Now, I did see a question come in here. Don Mayville said the rate may also increase if there are catastrophic occurrences. Yeah. So Don, what's really great about these United Healthcare plans is you may have a rate increase, which is common with all carriers, right? All health insurance carriers potentially will give you a rate increase. But Don, what I think you're going to really love about these United Healthcare plans is the fact that if you get a rate increase because you've had excessive amounts of claims, we can go back to these carriers and I can negotiate what that rate increase will be. And I'll give you an example. I insure 2 local Harley-Davidson dealerships where I live. They had an excessive amount of claims. They had one person on their plan that had over $130,000 of claims. Okay. Now the good news is they did have a rate increase. Okay. That rate increase was going to be a 40% rate increase. I went back to the carrier and negotiated that rate increase down to 2%. As long as they would renew with us, United Healthcare agreed to go down to a 2% rate increase for them. So we have the ability, if you ever do get a rate increase, to negotiate those rate increases down. And why that is important, if you're a business owner on here, is because a lot of these carriers, the Blue Cross Blue Shields, a lot of these other carriers that are in the market, they don't negotiate a rate increase. If they give you a rate increase, that's what you're faced to accept, whether you like it or not. And that puts a business owner in a very tough spot because they don't want to take the benefits away from their employees, but they also might not want to or even be able to afford to pay for that rate increase. Where if you join on a United Healthcare level funded plan, we have the ability to try to negotiate what your rates will always be at your time of renewal to keep the cost of that insurance affordable. And that way you can continue to offer those benefits to your employees.
Hey, Mitch, will you everybody please how having a catastrophic event that the stopgap protects them a little bit so that everybody feels comfortable with that.
Yep, absolutely. So these health insurance carriers with United Healthcare, they have a stop loss protection in there. Okay. So what's nice is if you do have a catastrophic event, which let's face it, that happens, guys. That's why you buy health insurance. Sometimes people get sick and you have a catastrophic event. That's why we have insurance. This United Healthcare plan will easily cover that catastrophic event. And they also have a stop loss carrier to where if the medical bills just pile up to a certain point, the stop loss carrier actually will pay for those medical bills above once they hit a certain threshold of medical bills. So that also helps keep the price of your insurances low because they have a stop loss carrier helping to cover some of those medical bills as well. So there's a lot of really, really great features to these programs that we can have access to minimize and keep the cost low for these United Healthcare plans. Any other questions about that program? Bob, anything else that you'd like me to speak on that before we move into this other additional program that we have offering?
Well, the only thing I want to make sure everybody understands is number one, how many doctors and places we have here in Delaware because United was already here once before, how many are there, and then the ability to start anytime and not have to just be during
exactly
open enrollment.
Perfect. So I want to talk to you guys about the eligibility for this program. So one of the biggest hurdles with group health insurance is I'm a small business. I don't have enough employees to even start a group health insurance plan. Okay. The great thing about United Healthcare is we can insure them down to 5 lives. So if you're a small business, we can insure you as long as you have 5 benefit eligible employees. So basically 5 full-time employees. And then we can start that plan and get that going for you right away. Now, the great thing about these United Healthcare programs as well is there's not a set in stone open enrollment period. We can start this United Healthcare program at any time of the year. Doesn't matter. We can start these programs in the middle of the month if we had to. Okay. So you don't have to wait till January 1st to scramble to get enrolled in some type of a health insurance plan. These guys are very flexible. They will allow us to start at any time. The other thing I think everyone on this call will really appreciate is we can custom build these programs any way that you want. So if you want to offer a low deductible plan and a high deductible plan and maybe a middle deductible plan, we can do that. We can even build plans out that'll have a built-in HSA account or an HRA or an FSA. We're a full-scale employee benefits brokerage. So if you're a startup company and you want to put together a very rich benefit program, we can do that. We can handle the health insurance, the dental, the vision. We can do retirement programs. Everything that you would ever need, we can put together, and you get access to that through the Delaware Small Business Chamber.
So one other thing I just want you to clarify for everybody, you're mentioning 5 eligible employees. Do all 5 of them have to be written, even if they're eligible, they all have to be written into the program?
Yes, we would have to have 5 eligible employees sign up for the insurance. Yeah. So, which is, and here's the thing though, what is interesting about this program is if you have 5 eligible employees sign up, and let's say in the middle of the calendar year, for some reason, a couple of them fall off, they will continue to insure you. Okay. So we have to have during open enrollment, have 5 eligible employees at the time of signing on for this.
Are we talking about the one with the 2 as well today?
No, we're going to talk about America's Choice next.
Okay,
Yeah.
go ahead.
Perfect. So the United Healthcare program does require 5 eligible employees. Here's what else is very exciting and which is very uncommon. We also have an additional program called America's Choice. Okay. They are an absolutely fantastic carrier to work with. We can write this program either individually, which is one life, or if you want to run a group platform health insurance plan, we can write this down to as small as 2 lives. So what is really great about this program is it's a full-fledged health insurance plan, and it's what they call simplified issue. So in order for you to qualify, you answer about, I think it's 8 to 10 questions is it. And as long as you answer no to what we call knockout questions, you automatically are guaranteed issued that plan. So these questions aren't hard to answer. It's basically asking you if you've ever had any catastrophic illnesses like open heart surgery or AIDS or HIV. So this America's Choice program is a full-fledged health insurance plan, okay? And it uses, and you're going to love this, it uses the Blue Cross Blue Shield network, and it also uses the PHCS network, which these are the largest networks on the planet. So these insurance plans are accepted everywhere out there. So through the Delaware Small Business Chamber, you can insure one life all the way up to thousands of lives, okay? Because our plans, we can insure over 1,000 lives if you have a very large business. But these America's Choice plans, what you're going to love about them as well is the rates on these programs are what we call a composite rate. So based on your age, they're an age-banded composite rate. So for example, if you are between the age of 45 and 50, you have one set rate. From 51 to 55, you have a set rate, okay? And here's what else is exciting about those programs. The rates don't increase on that program. The rates are what they are, okay? So we've got some really great health insurance options here. We've got United Healthcare level funded plans, which are unbelievably competitive. They will go down to 5 lives. We've got the America's Choice plans now as well, which will go down to as little as 1 life if we need to just insure an individual. So I can't tell you, I work with chambers of commerce across the United States. I can't tell you how many businesses are just mom and dad, or their dad and their son. They're a 2-person company. These are an absolutely fantastic solution for those small businesses that are looking for affordable healthcare insurance. And we can do that now with the help of Bob and Howard through the Delaware Small Business Chamber. Anything else, Bob, or any questions, guys, about that before we move on to the next program that we're offering? All right. Looks like I'm just going to check the chat. Okay. Now, the next program, okay, we got a question coming in here. Don Mayville said, I presume I cannot offer insurance if I have a personnel on a 1099 independent contract. That is a very good question. You absolutely can. We've got some carriers, okay, that we can insure a 1099 employee. Now, as long as they potentially are through your payroll, Don, you can offer this to a 1099 employee. In fact, that America's Choice plan is awesome for those 1099 employees. Did that answer your question, Don? Oh, perfect. Excellent. Yeah, so I'm really glad, Don, that you brought that up. A lot of businesses have 1099 employees, right? Maybe they're subcontracted or so forth. Okay. As long as they're on your payroll, we can offer this to basically anybody. Okay. Now, I will tell you, the United Healthcare level funded plans, we cannot offer that to 1099 employees. Okay. They do have to be a W-2 full-time employee. However, that America's Choice plan, and by the way, the rates on that program are fantastic for what the coverage is. Those can be offered to 1099 independent employees. So very good question. Perfect. Okay. Now, I do want to talk about a super exciting program that is going to be offered as well through the Delaware Small Business Chamber. This program, and I'll tell you guys, this is my favorite program to offer. I've been doing employee benefits for 17 years. This is by far the most unique benefit I think you'll probably ever come across. And let me tell you why. This program is going to save a business money versus cost a business money. Okay. So what this program is called, it's called the CHAMP plan. Once again, this is an exclusive program that's offered through the Delaware Small Business Chamber. What this program is, it's a health management plan. It's a voluntary benefit. Now, if for those of you on the call here today that are not familiar with what voluntary benefits are, a voluntary benefit is just a benefit that you offer an employee and they can take it or leave it. But it is basically like a dental plan or a vision plan. This is a voluntary benefit. Now, here's what's exciting about this benefit. This benefit is going to save the business money and not cost the business money. Okay. Now, you don't have to, just so you know, you do not have to have our health insurance through the Delaware Small Business Chamber to have this benefit. Okay. But I will tell you what you're going to love about this health management program is this program is going to save a business over about $600 per employee per year in payroll taxes. So for example, if you have a company of 10 employees, this program will save the business about $6,000 of payroll tax. Okay. So we just did a 100-person enrollment for a furniture store franchise. We saved that business almost $60,000 in payroll tax. Why we're so excited to offer this program is because obviously we all know to be a member of the Delaware Small Business Chamber, there's a membership fee, right? Okay. Well, if you have 5 employees or more, you can enroll in the CHAMP plan. And this will save, like I said, almost $600 per employee per year in payroll tax. Well, guess what you can do with that tax savings? You can become a member of the Delaware Small Business Chamber. Guys, I work with chambers of commerce across the nation, and they're using this program to cover your membership. So if you've always wanted to be a member of the Delaware Small Business Chamber, but maybe you didn't want to pay the membership fee, now you don't have to. As long as you have more than 5 employees, we can enroll you in this voluntary benefit. And for every employee that signs up for this program, it's going to save you about $600 per year in payroll tax. Here's another cool feature.
Right, just to clarify something, you still have to pay us our membership fee. You're just going to get it back from the insurance. So let me make sure that's all clear to everybody. You still do have to pay us.
You still got to pay the fee. You know, you still have to pay the fee to be a member, but this program's going to put the money in your pocket to use to pay for that fee. Okay. Now, here's an exciting feature. The CHAMP plan, if the employee enrolls in this, they're going to see their paycheck increase about $125 a month. Now, all they have to do is participate in the program. This health management plan, what it is designed to do is give your employees a track to run on to become healthier. Okay. So when they enroll in this health management plan, they're going to have to answer about 20 questions. These 20 questions are going to be about their health. Okay. Because we're going to determine areas that they need to improve on their health. Now, if your employee is willing to watch a 5 to 7 minute virtual treatment one time per month, they're going to get paid an insurance claim payment that will boost their paycheck about $125 to $150 a month. Here's a fun statistic. When we introduce this to a business, we have over a 90% participation rate. So nearly every employee takes the CHAMP plan when they're offered it because they get a boost in pay. So they get paid to become healthier. Now, what's exciting is not only will your employees see a boost in pay, the business saves payroll tax by offering this program. So every employee that enrolls in it's going to make more money, and then the business saves payroll tax. Okay, and keep in mind that payroll tax, that's money you don't pay to the government, which can be used to cover the membership fee to become a member of the Delaware Small Business Chamber. Okay, now the third and last great feature to this program is the CHAMP plan offers free medical benefits. So now this isn't a full-fledged health insurance plan. You still need health insurance, right? But there are some medical benefits that come along with this program that come with it for free. And let me tell you what those benefits are. For every person that enrolls in the Champ plan is going to get free urgent care visits. Okay. So if they want to go to any facility around the area, they can use these benefits if they want to go to urgent care. They're going to get free primary care doctor visits. So if somebody wants to go get a checkup, a physical, they don't feel well, whatever it is, that's all covered. No cost. There's no copay to these benefits. They're free. They come with the program. We're also going to cover 23 preventative services. So if you have employees that want to get a checkup, a physical, a colonoscopy, anything, we have 23 preventative services that come with our program for free. We also cover 432 medications at no more than $1. So that's for the employee plus their family members. Okay. So if the employee wants to put their family on this plan, they're going to get free medications. Basically, it'll cost no more than $1. Okay. We also have virtual services. They're going to get teledoc, virtual direct primary care, where you can talk to a doctor at any time of the day. If it's 2:00 in the morning and you need to get some medical advice, you can log on to the Champ Plan app and talk to a live doctor. We also offer live virtual therapy sessions. So if you've got an employee that's struggling with maybe some depression, addiction, whatever it may be, anxiety, and they need to talk to a professional, they can do that for free. So they get free mental health therapy sessions from a board certified therapist, free of charge. So if you become a member of the Delaware Small Business Chamber, you can have access to this program that will save you almost $600 per employee per year in payroll tax. It'll increase your employees' paychecks about $125 a month, and you get free medical benefits. Now, you're probably wondering, what in the heck is the cost of this Champ plan? Here's the great part about this program. The Champ plan creates enough tax savings by how it works through your payroll system that it will, the cost of the plan, because there is a cost to this, guys, this is not a free program, but the cost of the program, it creates enough payroll tax savings to cover the cost of the program. So at the end of the day, this is the only benefit that I've ever seen in 17 years that has no net cost after it is cycled through your payroll. So we're currently right now enrolling the city of Miami-Dade on this program. It's 36,000 employees, and we're saving the city of Miami-Dade $20 million with this program. So it is a fantastic program. It is a way to save money. I know that Rich said, "Hey, we're trying to save money here. We're trying to do something to grow our startup company." This is an absolutely fantastic solution for a business like that. But even if you're a well-established company, you've got 3, 4, 5, 600 employees, still a very great solution for your business to save some money, put some more money in the employee's pocket, and give some additional medical benefits. Now, last thing I'm going to say before we open up to questions, you're probably wondering, how would the Champ plan work with our major medical that we already have? Because the Champ plan provides some medical benefits. What you will love about the Champ plan is the medical benefits that the Champ plan provide. They work right alongside of any existing medical benefits. And why that is such a great thing is because if you have the additional Champ plan benefits running alongside of your major medical, for those select services that the Champ plan provide, that means you're going to have less claims on your major medical insurance. So guys, guess what that does then? If you have less claims on your major medical insurance, your renewal rates are better. So this is such a fantastic way to keep the cost of your health insurance low that you currently have if you offer these additional medical benefits through the Champ plan. We actually have health insurance carriers right now that if we pair the Champ plan with their health insurance, they'll give us a 5% discount a lot of times on the monthly rate because they know they're going to have less claims on their major medical. So I want you guys to realize that no matter if you have a good health insurance plan in place with your business that you're happy with, the Champ plan can still be paired right next to it, and it'll save you a ton of money. So any questions about the programs? I know we've really thrown a lot at you guys, but they're exciting things. And these things are going to hopefully save your business money.
What geographic coverage of the employees are eligible? Do they all need to be Delaware residents, Pennsylvania residents? Because we literally have them, or hopefully we'll have them stretch from coast to coast.
Very good question. We can offer this program through the Delaware Small Business Chamber. It doesn't matter if your employees are on California, if they're in Florida, we can centralize that through the Delaware Small Business Chamber, but we can insure them throughout the whole U.S. Yep. In fact, we're in the heat of closing Buffalo Wild Wings, and they have locations all over the United States. So yeah, we definitely can handle that. Any other questions? Anything else, Bob, that you'd like me to cover that maybe I missed? Howard, anything that I missed?
I don't think you missed anything. I'll just kind of buddy up in terms of the Champ, is that Champ and Major Medical are two separate independent programs that complement each other. And so if your business is in a position that you feel like, as competitive as the insurance rates with United Healthcare could be, it still might be unaffordable. At least Champ can now provide something for your employees. It's not full comprehensive, but to me, something is better than nothing. Because the worst feeling in the world is to have an employee, if you're 5, 10, 15, person team, is to have an employee come to you, say, I love working here, but you provide no benefits, and I'm going to have to go to the guy down the street.
Absolutely. Yeah, and we always like to say that the Champ plan is kind of the first step to maybe getting a group plan in place. So if you're looking just to provide some type of benefits, because here's a good statistic. We surveyed a lot of our groups that we have on group health insurance, and we surveyed some of the employees. 47% of the employees that we surveyed said their benefits were more important than their pay. Okay. So the Champ plan, if you have no benefits in place, that's a great solution to just get something in place. And remember, we're not only just giving some benefits, you get to boost in pay. So not only are you going to provide some benefits for your employees, you're going to boost their pay for them as well. And maybe down the road, we can look at putting a group health insurance plan in place for you because you boosted their pay and you saved some money on payroll tax.
The only thing I want to say, first of all, and answer Don's question, the Champ program is separate than insurance. So it will work with any insurance program, whether it's America's Choice or the United Healthcare or something else you might have. So they're two completely separate things. The other thing, at least for the health insurance, I don't know about the Champ. I don't know if we ever mentioned this together, guys. But health insurance side, if you have an insurance broker that you use, they can work with Howard and Mitch and sell this program through them. I don't know about the Champ program. I don't know if we talked about that, but
Yeah.
But this is something that we made sure that any broker that sells insurance can do this with them.
Yeah, and I'm so glad, Bob, that you brought that up. If you've got someone, maybe guys that you have worked with for years and you trust that person with your insurance, that's okay. We play nice with everybody. So we work with brokers all the way across the United States.
Well, almost everybody.
Almost everybody.
Yeah.
Bob, you know me, I love everybody. All right. I like to try and play great with everyone, but
I have one in particular we won't let you do.
That's all right. I'll be behind enemy lines. You guys can handle that.
There you go.
So but I do want you to know, though, we would love to introduce this to anyone that has interest to this. If you have a favorite broker, that's no problem. But we are exclusively marketing this, just so everyone is clear. This is exclusively through the Delaware Small Business Chamber. We have an agreement in place with these folks. Get a hold of Bob. We would love to work with whoever would like to. So
it's have them get a hold of me, have them talk to me. This is something that I'm very proud to be bringing into Delaware. It's something that both Howard and Mitch know has been a passion for me, and we've had an issue with our government here in Delaware that doesn't, didn't want to save money for businesses, and now we have something that I think will work. Rich, Rich obviously knows how that is, right?
I got to deal with that today.
There you go. So, we're proud that this is something that is a big organization across the board, something that cannot be discounted by anybody at upper level. And we're proud to be the first one to bring it into Delaware. And Howard and Mitch are going to work closely with us and some of you guys to make sure this works. But I really think it's going to be a game changer for especially small businesses in the state of Delaware, and we're going to continue to fight hard for that.
Excellent. Perfect.
Bob,
Well,
sorry, Mitch. I'm just going to include a calendar link in the chat. So if someone wants to reach out to me or Bob, if you now just want the link to include in whatever future communication, it's there for you.
Absolutely.
Yeah, the one thing I'll say, guys, if you know of a company or some of you work with companies that want to, please get them to quote this plan quickly. We're coming to an end of the year. I know some companies have open enrollment. Again, they don't. But let them quote this right away for anybody. That way they have some time to look at it, negotiate. And let's be honest, some of these people could get out of what they have now for the last couple of months and canceled whatever they have and save money now. So it is a great opportunity for those of you. I know a few on this call do work with other small businesses. And I think it could be a really good benefit for you guys and your customers and those of you that have small businesses already.
Yeah, absolutely. This is considered in our world renewal time. So this is the time to really take a look at what you can save. And I always tell everybody we quote the insurance with. There's no pressure to switch. Just because we give you a quote and you see the savings, we're just going to show you that, hey, this is how much you could potentially save. So don't feel like if we quote your insurance that you automatically have to enroll with us. We're just going to give you the option. But I think once you see the numbers and you see that we can save literally thousands of dollars through this program, I think you'd be more inclined to potentially switch over. And United Healthcare is one of the biggest names in the industry. So we love that part. Don has
another real quick. Don had a question here. Don, it depends on which requirement you're talking about. Having the CHAMP program, I do not think gives you the health insurance that you're required by federal law now, but either the other two will. But if you're talking about the Delaware one that's just come into effect, that has nothing to do with health insurance. That has to do with retirement insurance program. So, and I send an email to our members of people that can do that for you. So that's a different. I don't know which requirement you're asking about.
I'm thinking, and correct me wrong, Don. I think if I'm wrong here, but I think, Don, you might be talking about for businesses that have over 50 employees. Just so you know, there are requirements. If you have over 50 employees, you are required to provide what the government calls minimum essential coverage. And yes, our plans, the America's Choice plan and the United Healthcare plan, they do cover that. It does suffice as a qualified minimum essential coverage. It's actually much better than that because minimum essential coverage is a limited benefit plan. They are not considered full-fledged health insurance. These programs through United Healthcare and through America's Choice are full-fledged health insurance, which easily satisfies that minimum essential coverage requirement. So if you have a company over 50 employees, absolutely, this is the solution for it. That
CHAMP does not, right?
CHAMP does not cover it. So Champion Health does cover. You get into the weeds a little bit. So with the government, if you have over 50 employees, minimum essential coverage, if you don't provide that, there are two penalties. There's Part A and there's Part B. The CHAMP plan does actually cover the Part A penalty. So it doesn't fully cover the requirements to provide minimum essential coverage, but it does cover some of it. So I would recommend getting a full-fledged health insurance plan to completely cover the requirements that the government requires. So.
Yeah, I thought it'd come off voicemail, but thanks for all I prefer writing my questions. It makes it clear, but thanks for the clarifications.
Yeah. And great chance. Perfect. Yeah, great questions, by the way, Don. Those are really important questions, actually. So
another one for you, Mitchell.
Yeah.
Can a specific employee be excluded?
It depends on how you are you talking in regards to like just being offered the insurance or just taken off of the plan in general? Can you be a little more specific, Rich?
We have one individual that does have catastrophic issues, has coverage through other means, so would not require the coverage through a company.
Yeah.
Can we say this individual is not part of the plan?
You technically, you technically, if they're on your payroll, they have to be offered it. Doesn't mean they're required to take it though. And a lot of times what we'll do in that situation, because we do this a lot, is we will get that person an individual plan that is super competitive in benefits and pricing. That way they're not affiliated with the group in general, because let's face it, someone that has a catastrophic condition can make the rates go right through the roof. So we like to do what we call a carve out on that. You legally have to offer that insurance, but a lot of times they won't take it because we're going to offer them some type of other individual plan. So that's the route we would take with that.
Yeah, Rich, you got to be careful of the wording that you said there, Rich, because you can't exclude an employee. You cannot say, hey, we're not going to even offer it to you. But if they already have coverage elsewhere, they can turn it down and say, no, I'm covered elsewhere. That's the difference. They can turn it down. You cannot exclude them.
They have to decline the coverage. They actually say they'll sign a waiver that says they were offered it, but they declined it. And a lot of times we can get them a very competitive plan on an individual. I actually work with a lot of big business owners that know it's better to pay for that employee's insurance so they get it for free rather than to have them actually on the group plan. So a lot of times we'll say, do you want a free plan or do you want to be on the group plan? They go, well, I want the free plan. Well, exactly. Well, now we've carved them off the plan. So that's the way we usually run it, depending on what the needs are of that employee. Yeah, great questions, though. I appreciate it.
Well, I want to thank everybody for joining us this morning. I want to thank Howard and Mitch for this. We're going to take this recording and send it to a lot of other people as well. And we're going to try and arrange one more of these in the next couple of weeks if we can, so that we get other people to attend. But I think that you guys all should have a better understanding of what we're trying to offer here for our small businesses. A lot of people are saying that they're trying to do stuff well, we actually have done it. So with the help of Howard and Mitch, I think that's going to be a big thing for us and for the state, and to bring in another program and just so everybody knows, and I think Mitch talked a little bit about it, the traditional programs out there are all risk. The other options that were out here is self-insurance, which can be pretty risky for a business. This is a level funded plan, which is kind of in the middle of those two things, which helps the small business without having to have a potential problem or risk or even issues with somebody trying to write it. So that's a big difference, I think.
Yeah. These programs, what you guys will start to see is these level funded plans are really starting to be the most desirable type of group health insurance, because there's so much flexibility with it and the rates are so competitive and the coverage does exactly the same as all the others on the market. So you can get a plan that does the same thing as what traditional insurance has done, but you can get it for potentially thousands of dollars less. And then we can negotiate what your rates are going to be. Because wouldn't it be nice to know that you have someone in your corner that can potentially negotiate what the cost of your insurance is year after year to keep it low so you can continue to offer it? That's what we can do for you.
And you can use half of your savings and invest it in the chamber. No.
Yes. And for everybody that enrolls in the champ plan, me and Howard get a steak dinner. So that's wrote in the
There you
contract
go.
as well.
Yeah. Yeah, but you have to come here to get it.
Yeah, I got to go all the way
But
to
again, I want
Delaware.
to say thanks to everybody, guys, and I hope you spread the word about it. And if any of you would like an informational flyer that I have, or on the United Healthcare Program, email me. I'll send that to you. If any of you would like the link to our CHAMP program, Mitch, I thought Richard said he put it on our website. I don't see it there, but I have a link. If any of you guys want the link to the CHAMP program that you can put in and request, just send me an email. All of you that got the email for today should have my email, and we'll go ahead and send that over to you. But I thank everybody again for coming out, Mitch and Howard. I thank you guys.
Thank you.
And wish everybody a wonderful, wonderful rest of the week.
Perfect. Thanks, guys. Let us know if we can help anyway.